When you get injured, you obviously become quite nervous and anxious that you're unable to progress. It takes a while to prove to yourself that you can actually get better and succeed in your rehab. So once you sort of get the ball rolling, that's probably the easiest part and the hardest part. Generally speaking, they'll get medical clearance from one of our doctors, and then once they've got medical clearance or they've gone there through their procedures, then they'll come and get referred to me to start a rehab program. Depending on the procedures, it can be almost immediate, and then some can be up to a few months before they start rehab. The good thing about these machines is we can track their range of motion over a time period, so they feel safe and comfortable to slowly progress over each session. So once we do an initial assessment, we find out what movements cause pain and which ones are generally more comfortable. Then we progress them through a 2 to 3 month program where they improve their capacity, their endurance, and then we build the exercises into their everyday life, such as like rotating, twisting, bending, flexing, that kind of thing. Basically, we set it to start with where their kind of comfortable parameters are, and then over the weeks we progress and try and build upon what their current capacity is. So it's quite good to see visually the improvements over the weeks rather than just anecdotal experience. It's probably 50-50 split between in-person sessions, computer work, report writing, trying to get more funding for clients, telehealth sessions, creating exercise programs for at home and gym, particularly for a lot of clients that can't come in to see us on a regular basis. So checking in with them via emails and phone calls and those kinds of things, pretty common as well. It's good to get them to come in, do an initial assessment, and we can run through a basic exercise screening to make sure they're safe. But once that's completed, then generally speaking, we can do a lot more online. The difference in between, being quite nervous and anxious about exercise and someone actually really trying to push themselves is huge. It is a huge factor, and it's important to work alongside psychologists and doctors and pain specialists to sort of manage those sides of things. But it's good to see where they're at and slightly progress them each session and just watch them manage those psychological barriers on their own rather than me telling them that they have them. That's quite a big feat to sort of let them figure those things through their exercise and rehabilitation. They kind of figure it out by themselves most of the time.